very important video of mine because this is a very common condition all over the world. I'm talking about the acne. Acne is a skin condition that occurs when your hair follicles become plugged with oil and dead skin cells. It often causes whiteheads, blackheads, or pimples and usually appears on the face, forehead, chest, upper back, and shoulders. Acne is most common among teenagers, though it affects people of all ages. Effective treatments are available, but acne can be persistent. The pimples and bumps heal slowly, and when one begins to go away, others seem to crop up. Depending upon its severity, acne can cause emotional distress and scar the skin. The earlier you start treatment, the lower your risk of such problems. Now let me tell you some of the symptoms. Acne signs and symptoms vary depending upon the severity of your condition. First of all, there are whiteheads, which are closed plugged pores, then blackheads, which are open plugged pores, small red tender bumps, papules, and there are pimples, which are also known as pustules, which are papules with pus at their tips. And there could be large solid painful lumps beneath the surface of the skin, which are known as nodules. Also, there may be painful pus-filled lumps beneath the surface of the skin, which are cystic lesions. If self-care remedies don't clear up your acne, see your primary care physician. He or she can prescribe stronger medication. If acne persists or is severe, you may want to seek medical treatment from a doctor who specializes in the skin and as known as dermatologist. For many women, acne can persist for decades with flares common a week before menstruation. This type of acne tends to clear up without treatment in women who use contraceptives. In older adults, a sudden onset of severe acne may signal an underlying disease requiring medical attention. The Food and Drug Administration (FDA) warns that some popular non-prescription acne lotions, cleanser, and other skin products can cause a serious reaction. This type of reaction is quite rare, so don't confuse it with the redness, irritation, or itchiness where you have applied medications or products. You should seek emergency medical help if after using a skin product you experience faintness, difficulty breathing, swelling of the eyes, face, lips, or tongue, or tightness of the throat. Now let me tell you some of the causes of acne. There are 4 main factors which cause acne: excessive oil production, and if hair follicles clogged by oil and dead skin cells. Third number is bacteria, and fourthly it is excessive activity of a type of hormone known as androgen. Acne typically appears on your face, forehead, chest, upper back, and shoulder because these areas of the skin have the most oil, there are sebaceous glands which produce oil, you should know, and hair follicles are connected to these sebaceous glands. Oil glands are connected with the hair follicles. The follicle ball may bulge and produce a whitehead, or the plug may be open to the surface and darken, causing a blackhead. This is what I told you initially. A blackhead may look like dirt stuck in pore, but actually the pore is congested with bacteria and oil, which turns brown when it is exposed to the air. So there are misconception about the acne that it is caused by dirt. So no, I hope this misconception is clear after watching this video of mine, because they are not caused by dirt. Okay, anyway, pimples are raised red spots with a white center that develop when blocked hair follicles become inflamed or infected with bacteria. Blockages and inflammation that develop deep inside hair follicles produce a cyst-like lump beneath the surface of your skin. Other pores in your skin, which are the openings of the sweat glands, are not usually involved in acne. So you should come to know that sweat glands are not involved in acne. These are the sebaceous glands which are connected with the hair follicle are involved. Okay. Now let me tell you some of the factors that may worsen acne. These factors can trigger or aggravate acne, such as hormones. Androgens are a hormone that increase in boys and girls during puberty and cause the sebaceous gland to enlarge and make more sebum. Hormonal changes related to pregnancy and the use of oral contraceptives also can affect sebum production. And low amounts of androgen circulate in the blood of women and they can worsen acne. You should remember that androgens are not only male hormone, they are also found in small quantities in females as well. So these are responsible for this acne. Okay. And there are certain medication, for example, corticosteroid, testosterone or lithium, that can also aggravate acne. And there are some dietary factors. The studies suggest that certain dietary factors, including skim milk and carbohydrate-rich fruits such as bread, bagels and chips, may worsen acne. Chocolate has been long been suspected of making acne worse. A small study of 14 men with acne showed that eating chocolate was related to a worsening of symptoms. Further study is needed to examine why this happened and whether people with acne would benefit from following special dietary restrictions. And another factor is stress that can make acne worse. You should remember that stress does not cause acne, but if you have acne, then stress can make it more worse. And here are some myths which I should tell you. These factors which I am going to tell you have little effect on acne. First of all is greasy food. Eating greasy food has little or no effect on acne, though working in a greasy area such as the kitchen with fry vats does because the oil can stick to the skin and block the hair follicles. This further irritates the skin or promotes acne. So this myth is also clear that greasy food don't cause acne. It's actually the grease, if it is stuck to the skin while working in a kitchen, can block the pores and can cause acne. Secondly, the hygiene. Acne is not caused by dirty skin, so you should be clear in this. In fact, scrubbing the skin too hard or cleansing with harsh soaps or chemical irritates the skin and it can make acne worse. Thirdly, cosmetics. Cosmetics do not necessarily worsen acne, especially if you use oil-free makeup that does not clog pores. These are known as non-comedogenics, and remove makeup regularly. Non-oily cosmetics do not interfere with the effectiveness of acne drugs. So I hope this myth is also clear, because water-based cosmetics do not cause acne. It's only the oil-based cosmetics which can cause problems. Now let me tell you some of the risk factors for acne, which include age. People of all ages can get acne, but it's most common in teenagers. Hormonal changes. Such changes are common in teenager women and girls, and people using certain medication, including those containing corticosteroid, androgen or lithium. Then comes the family history. Genetics play a role in acne. If both parents had acne, you are likely to develop it too. Greasy or oily substances. You may develop acne where your skin comes into contact with oily lotion and cream, or with grease in a work area such as the kitchen with fry vats, as I just mentioned. Then there is if there is a friction or pressure on your skin due to items such as telephones, cell phones, helmets, tight collars and backpacks. Also, stress does not. You should remember that stress does not cause acne, but if you have acne already, it may make it worse. Now let me tell you the diagnosis and treatment of this problem, which is very common. Okay. This diagnosis is easy by just looking at the signs and symptoms of acne, the things which I told you already. So let's come to the treatment. If you have tried over-the-counter non-prescription acne products for several weeks and they have not helped, your doctor can prescribe stronger medication. A doctor can help you in controlling your acne, avoid scarring or other damage to your skin, or make scars less noticeable. Acne medication work by reducing oil production, speeding up skin cell turnover, fighting bacterial infection, or reducing inflammation, which help prevent scarring. With most common prescription acne drugs, you may not see results for 4 to 8 weeks, and your skin may get worse before it gets better. It can take many months or years for your acne to clear up completely. The treatment regimen your doctor recommends depends upon your age, the type and severity of your acne, and what you are willing to commit to. For example, you may need to wash and apply medication to the affected skin twice a day for several weeks. Often, topical medication and drugs you take by mouth are used in combination. Pregnant women will not be able to use oral prescription medication for acne. You should talk with your doctor about the risks and benefits of medication and other treatments you are considering. And now let's come to some topical medications. And the most common topical prescription medication for acne are Retinoid and retinoid-like drugs. These come as cream, gels, and lotion. Retinoid drugs are derived from vitamin A and include retinine, such as Avita, Retin A, and others. Adapalene comes with the name of Differin and Tazarotene, Tozarec. You apply this medication in the evening, beginning with 3 times a week, then daily as your skin becomes used to it. It works by preventing plugging of the hair follicles. Second is antibiotics. The topical antibiotics. These work by killing excess skin bacteria. The bacteria is P. acnes, which is involved in acne formation. So these antibiotics work by killing excess skin bacteria and reducing redness. For the first few months of treatment, you may use both a retinoid and an antibiotic, with the antibiotic applied in the morning and the retinoid in the evening. The antibiotics are often combined with benzyl peroxide to reduce the likelihood of developing antibiotic resistance. Examples include clindamycin with benzyl peroxide, that comes with the name of benzathine duac acania, and erythromycin with benzyl peroxide, that is benzamycin. Topical antibiotics alone are not recommended. So you should remember that these alone don't work that much, and usually they are combined with the topical retinoid, which I told you before. Then comes another medicine that is known as salicylic acid and azelaic acid. Azelaic acid is a naturally occurring acid found in whole grain cereals and animal products. It has antibacterial properties. A 20% azelaic acid cream seems to be as effective as many conventional acne treatments when used twice a day for at least 4 weeks. It's even more effective when used in combination with erythromycin. Prescription azelaic acid, that is coming with the name of Azelix financia, is an option during pregnancy and while breastfeeding. Side effects include skin discoloration and minor skin irritation. Salicylic acid may help prevent plugged hair follicles and is available as both wash-off and leave-on products. Studies showing its effectiveness are limited. Then comes another drug known as dapsone, which is a 5% gel. Twice daily is recommended for inflammatory acne, especially in adult females with acne. Side effects of dapsone include redness and dryness. Evidence is not strong in support of using zinc, sulfur, nicotinamide, resorcinol, sulfacetamide, sodium or aluminum chloride in topical treatments for acne. Let me repeat these products because there may be some misconception about these things. You should remember the zinc, sulfur, nicotinamide, resorcinol, sulfacetamide, sodium or aluminum chloride in topical treatment for acne are not helpful. Now let me tell you some of the oral medications. These, first of all, I'll tell you about antibiotics. For moderate to severe acne, you may need oral antibiotics to reduce bacteria and fight inflammation. Usually, the first choice for treating acne is tetracycline, such as minocycline or doxycycline, or a macrolide such as azithromycin. Oral antibiotics should be used for the shortest time possible to prevent antibiotic resistance. Oral antibiotics are best used with topical retinoid and benzyl peroxide. Studies have found that using topical benzyl peroxide along with oral antibiotics may reduce the risk of developing antibiotic resistance. Antibiotics may cause side effects such as an upset stomach and dizziness. These drugs also increase your skin's sun sensitivity. The next comes combined oral contraceptive pills. There are 4 combined oral contraceptives which are approved by FDA for acne therapy in women who also wish to use them for contraception. They are products that combine estrogen and progesterone, such as orthotricycline, Yaz, and Yaz. You may not see the benefit of this treatment for a few months, so using other acne medication with it the first few weeks may help. The most common side effects of these drugs are weight gain, breast tenderness, and nausea. A serious potential complication is a slightly increased risk of blood clots. So you should remember the side effects of combined oral contraceptive. Okay, the next comes anti-androgen agents. The drug spironolactone, which comes in the name of aldactone, may be considered for women and adolescent girls if oral antibiotics are not helping. It works by blocking the effect of androgen hormone on the sebaceous gland. Possible side effects include breast tenderness and painful periods. The next is isotretinoin. Isotretinoin, which comes in the name of amnisteam, Claravis, and Sotret, is a powerful drug for people whose severe acne does not respond to other treatments. Oral isotretinoin is very effective, but because of its potential side effects, doctors need to closely monitor anyone they treat with this drug. Potential side effects include ulcerative colitis, which is an increased inflammation in the bowel, in intestine, okay, and there could be an increased risk of depression and suicide and severe birth defects. So this triacetin carries such a serious risk of side effect that all people receiving isotretinoin must participate in a Food and Drug Administration approved risk management program. Then there are some other therapies which some people take up. These therapies may be suggested in selected cases. They are either alone or in combination with medication. First of all is laser and photodynamic therapy. In this, a variety of light-based therapies have been tried with some success, but further study is needed to determine the ideal method, light source and dose. Then there is a method of chemical peeling. This procedure uses a repeated application of a chemical solution such as salicylic acid, glycolic acid or retinoic acid. Any improvement in acne is not long-lasting, so repeat treatments are usually needed. Then there could be a treatment which is extraction of whiteheads and blackheads. Your doctor may use special tool to gently remove whiteheads and blackheads and that have not cleared up with topical medication, but this technique may cause scarring. Then there is a option of steroid injection. If you have nodular and cystic acne lesions, these can be treated by injecting a steroid drug directly into them. This therapy has resulted in rapid improvement and decreased pain. The side effects of the local injection may include thinning of the treated area. Now let me tell you some of the lifestyle and home remedies. You can try to avoid or control mild acne with non-prescription products, good basic skincare and other self-care techniques such as you should wash problem areas with a gentle cleanser. Twice a day, use your hands to wash your face with a mild soap and warm water. If you tend to develop acne around your hairline, shampoo your hair every day and be gentle if you are shaving affected skin. Avoid certain products such as facial scrubs, astringents and masks. They tend to irritate the skin, which can worsen your acne. Excessive washing and scrubbing also can irritate the skin. Secondly, try over-the-counter acne products to dry excess oil and promote peeling. Look for products that contain benzyl peroxide as the active ingredient. You might also try products containing salicylic acid, glycolic acid or alpha-hydroxy acid, which may help with mild and moderate acne. It may take a few weeks before you see any improvement. Non-prescription acne medication may cause initial side effects such as redness, dryness and scaling that often improve after the first month of using them. Then you should avoid irritants, avoid oily or greasy cosmetics, sunscreens, hair styling products or acne concealers. Use products labeled water-based or non-comedogenic, which means they are less likely to cause acne. Then the next thing is that you should protect your skin from the sun. For some people, the sun worsens acne, and some acne medication make you more susceptible to the sun's rays. Check with your doctor to see if your medication is one of these. If it is, stay out of the sun as much as possible. Regularly use a non-oily moisturizer that includes a sunscreen. Then you must avoid friction or pressure on your skin. As I told you before, you should protect your acne-prone skin from contact with items such as phones, helmets, tight collars or straps and backpacks. Also, you should avoid touching or picking at the problem area. Doing so can trigger more acne or lead to infection or scarring. You must shower after strenuous activities. Oil and sweat on your skin can lead to breakouts. Then there are some alternative medicine options available. Alternative and integrative medicine approaches used in the treatment of acne include fish oil, brewer's yeast, probiotics, oral zinc and topical tea tree oil. More research is needed to establish the potential effectiveness and long-term safety of these and other integrated approaches such as biofeedback and traditional Chinese medicine. You must talk with your doctor about the pros and cons of specific treatment before you try them. So alternative medicine in this regarding acne are not still so much research, so you should be careful and always ask your doctor to help you for the treatment of your acne.